Hello, am I audible? Hi kids, am I audible? Am I audible? Audible? So, hi everyone. Hello. I hope I'm clearly audible and visible to you all. So, welcome to Unacademy NEET English. I'm your biology educator Ambika Sharma, and today we are going to finish the reproductive health. It was supposed to finish in the last class, but because of some urgency, I have to end that session. And now, right, I ended that session, you know it very well. So today we are going to finish it. So tell me everyone, how are you people doing? What's up? Am I clearly audible, visible? Yes. Am I audible, visible? Tell me quickly. Am I audible and visible to you all? Quickly tell me in the chat section, and then we will start the class. Okay. So guys, today we are going to finish the reproductive health, and tomorrow at 9 a.m. I am going to take a practice session, right? Top 50 questions from human reproduction and reproductive health for your quick revision. So we are going to complete them in 1 hour. So in 1 hour, we have to solve the 50 questions. Is that clear? Right, we have to solve the 50 questions in that 1 hour. This is what we need to do. This is what you people need to take care, right? And moreover, after this chapter, which chapter you people want to start, just let me know that. Right, you know that already in the evening we are talking about the biomolecules, right? We are discussing the biomolecules. In the evening I used to take the class 11th part, in the morning I used to take the class 12th part, right? So we will continue like this, but which chapter you people want me to start next, just let me know in the chat section, and accordingly I will start it, and obviously we will finish it, right? So these morning sessions are specially for your boards as well, for your NEET as well. It is basically for, not for the droppers. Obviously droppers can also attend it, but it is not just for the droppers. Those who are in class 12th, they should get maximum benefit out of it, because here I'm not running very fast, है ना? In the marathons, so in one go or in 2 lectures we are finishing the chapters, but here we are not going very fast. Okay, so we are going at a moderate pace, and that is how we are going to complete the syllabus. Is that clear? Right, so after the class, in the chat section, do let me know, and please share the link with your other friends so that they get to know that yes, ma'am is going to start the class, and then I'll continue. Right, share this link with others as well. Quickly share this link with others as well. Be quick. Let's increase the live count. Of course, very less number of students are there in the session, so let's increase the live count. So all of you just share the link with your friends as well. Quick. Okay, so today mainly we will focus on the contraceptive methods, infertility related issues, and then we will talk about the assisted reproductive technologies, right? So I'll give you an idea about the STIs, but basically STIs we will discuss in human health and disease chapter in detail. Is that clear? Okay, so what we have covered so far, we have started with the reproductive health. So you know that when it comes to the health, as per WHO, as per World Health Organization, we have to consider all the aspects. Isn't it? What we need to consider, kids? We need to consider all the aspects here. Here you people can see, when it comes to the reproductive health, it means a total well-being in all the aspects of reproduction, right, bache? It comes a total well-being in all the aspects of reproduction, right? Physical, emotional, behavioral, and social as well, right? So all the aspects will be considered. Isn't it? And the society should be reproductively healthy. Why? Because the reproduction, it's a phenomena by which, right, already existing individuals, they are going to give birth to the new individuals. So obviously it should be like society should be reproductively healthy when it comes to all the aspects of reproduction. Is that clear? Yes, bachiya, keep. Yes, everyone. Is that clear? Is that clear? Yes. Okay, so this is what we have covered in the last class, and in the last class we have already talked about the problems and strategies, the amniocentesis, everything. So today, let's start once again from the contraceptive methods, right? In the last class, we have discussed the natural method, but again, today, we will complete these in contraceptive methods. So let's start from the starting for your quick revision. So when it comes to the contraceptive method, now, but when it is the sexual reproduction, you know it very well, there will be the sperm and the ovum fusion. And it will result in the formation of a diploid zygote. Am I right? It will result in what? It will result in the formation of a diploid zygote. Now the zygote will multiply. Now the zygote will grow. Isn't it? Isn't it? The zygote will multiply, the zygote will grow, and it will form a complete individual. Isn't it? That is what reproduction is. That is how the growth will be there. We have already covered that in the embryonic stages. Right, Bache? Right? So, if we need to stop the process, you know that there are various ways, right? And the methods by which we stop the meeting of sperm and ovum, we stop the implantation of this zygote, we make endometrial lining unsuitable, right? When we talk about all these aspects, na bache, so they comes under the contraceptive devices. So contraceptive devices, the devices which are going to avoid the pregnancy. Clear, bache? What are they? They are the devices which are going to do what? Which are going to avoid the pregnancy. Is that clear, bache? Yes, is that clear? I'm reading your charts as well, so if there is any doubt, just let me know, kids. Just let me know. Okay, so this is what the contraceptive methods are, and at different levels we can stop it. So when you talk about these contraceptive methods, mostly we see that they are in the case of females, not in the case of males. Like males are also having the contraceptive methods in their case, but in the case of females, we have so many contraceptive devices. Okay, we have so many contraceptive devices. Can you tell me the reason? Can you tell me the reason, bache? Why is it so? Yes, good morning, good morning. Yes, everyone, good morning. So can you tell me the reason? Why is it so? Why in the case of females, we have more contraceptive devices in comparison to the male? Yes, answer it quickly, everyone. Just answer it to me quickly. Answer it to me. Why is it so? Why in the case of females we have more contraceptive devices in comparison to the males? Right? Because in the females we have different levels at which we can stop the pregnancy. Like in the case of females, right? Let's say if there is no ovulation, and even if the sperm is there in the female genital tract, there will be no pregnancy, right? In the case of female, we can prevent the implantation. We can make the uterus unsuitable for implantation, right? From the cervical canal, we can stop the passage of the sperms as well. So we have, in the case of females, we have different points where we can stop this pregnancy. So that is why the contraceptive devices, that is why the more contraceptive devices are there for the females in comparison to the males. Because males are just having one role, sperm production, and pass that sperms into the female genital tract. So obviously in their case, maximum what can we target? We can just target the sperm production. We can just stop it, or we can just prevent that sperm to be there in the vagina. That's all. Right, that's all. So that is why in the case of females, right, we have more contraceptive devices. Already I told you. Now when it comes to the ideal contraceptive device, the device which is user friendly, it should not be complicated, right? It should be user friendly. Even an illiterate person should know how to use the contraceptive methods. Are you getting my point? Are you getting my point? So it should be that easy to use. So it should be user friendly. It should be easily available. It should be easily available, and it should not play any role in disturbing the sex drive, that is the libido. Right? Right. It should not interfere with the sexual drive, and for the sexual drive we use the word libido. What is the word? That is the libido. Clear, bache? Clear, bache? So this is what we need to take care. So these are the ideal contraceptive devices which are having less side effects, user friendly, easily available, which are reversible, right, bache? And they should not interfere with the sexual drives, right, bache? So now when you talk about these birth control methods, there are so many methods, right? I have already discussed that with you, and let's have a quick revision of it. So I want you people to answer it quickly in the chat section. Okay, just answer it quickly in the chat section. All of you, be quick and answer it in the chat section. So what are we discussing? Contraceptive methods which are going to stop the pregnancy, right? They are contraceptive methods which are going to stop the pregnancy. So here you have temporary methods, okay? And in temporary methods, we have so many methods, and obviously they are reversible. And then comes the permanent method. So bache, when it is the permanent method, what will you include? Yes, tell me everyone in the chat section. In the permanent method, what are you going to include? Yes, everyone. In the permanent method, what are you going to include? Quick. Yes, very good, very good. Exactly, Dushyant. There will be the sterilization. Fire, bache, exactly. There will be the surgery. Exactly. So permanent method mein there will be the sterilization. Obviously here the reversibility rate is very, very, very less. I'm not saying there is no reversibility. There is. People try sometimes, but the reversibility rate is very less. It's very less, right? So permanent methods will include sterilization, and here we have the two things, right? We have two things. One is vasectomy and second one is tubectomy. One is vasectomy and second one is tubectomy. Vasectomy and the tubectomy. So now you know that when it is the vasectomy, vast difference. What will be targeted here? Vast difference. So vast difference is present in the male reproductive system. So it is in the case of males. So vast difference will be cut and tied. So in the semen, there is no sperm. There are no sperm. Sperm will not be there. Okay, sperm will not be there. Vasectomy. And then comes the tubectomy. So tubectomy, fallopian tube. Okay, so fallopian tube will be cut and tied. Again, so after egg formation, egg will not be there in that ampulla, right? It will not be there in that site of fertilization. So this is the permanent method. And when we talk about the temporary method, you have natural methods as well. Okay, barrier methods are there. Chemical methods are there. Hormonal methods are there. Fine. So natural method, barrier method, chemical method, hormonal method. So there are so many examples when it comes to the temporary methods for the contraception. Clear, bache? So now when you are talking about the natural method, so in the natural method, in the traditional method, these are the three things that we have. Periodic abstinence is there. Coitus interruptus, also known as withdrawal method, is there. And then comes the lactational amenorrhea, absence of menstruation. So kids, from this contraceptive devices, you guys can expect 1 to 2 questions in the NEET examination, let me tell you. Okay, you people can expect 1 to 2 questions in the NEET examination. So it is very, very, very important. And 1 question from the infertility part. So from this chapter also 2 to 3 questions can come in the paper, and this chapter is very scoring, very easy, right? You should know how these hormones work, that's all. That's also happening. Clear, bache? Clear, bache? So periodic abstinence, which is also known as a rhythm method, right? It is also known as rhythm method. So it is related to what? It is related to the periods. It is related to the menstrual cycle. Okay, it is related to the periods. It is related to the menstrual cycle. Okay, so now you know that in the case of a female, on an average we used to say that menstrual cycle is for 28 days or for the 29 days, right? In the case of female, that is what we used to say, that when you talk about the menstrual cycle, we know that on an average it is for the 28 days or for the 29 days, isn't it? And now when it is for the 28 days, right, we consider that 14th day is the day of the ovulation. 14th day is what? It is the day of the ovulation. So what is ovulation? Ovulation is the release of egg. Right, ovulation is the release of egg. So tell me quickly, bache, is it the egg that will be released or is it the secondary oocyte? Is it the egg that will be released or is it the secondary oocyte? Tell me quickly. Tell me quickly. Is it the egg, or is it the egg, is it the ovum, or is it the secondary, oocyte? Tell me quickly. Yes, secondary oocyte. So is there any arrest? Is there any arrest in that secondary oocyte or not? Is there any arrest in that secondary oocyte or not? Right? Of course, we know that there is the metaphase to arrest. So you know that on an average, it is for 28 days, and 14th day is the day of the ovulation. Right? 14th day is the day of the ovulation, and you can add plus minus 2 days. Like let's say 12th day, 16th day. So during this period, right? During this period, female should avoid the unprotected sexual intercourse. Right? During this period, what female should do? Female should avoid the unprotected sexual intercourse, because this is the fertility period. At this time, female is highly fertile. Right? If sperm is present in the female vagina, obviously there are chances that it will get fused with the ovum. So obviously pregnancy can occur. So during this time, the sexual intercourse should be avoided. Right? Sexual intercourse should be avoided during this period when you are talking about the rhythm method. So obviously it is not 110% correct. Female cannot be so sure about her ovulatory days. Isn't it? Isn't it? They can give it a try. And these days in the market, the people that want to conceive, right, in the market, ovulation kits are also available, so that female can get to know that when is her ovulatory period, right? And can you tell me the science behind it, guys, that how she can check her ovulatory period? Yes, bacho, how she can check her ovulatory period? Anyone in the class who can tell me this? How can she check her ovulatory period? Yes? How can she check her ovulatory period? Hormones. Yes, which hormone is there? Give it a try. Nice. Nice, bache. Right? And I really like those students who are reverting here, answering here. Even if you don't know the answer, just put it in the comment section. See, kids, I am not going to slap you. This is the beauty of online classes. I cannot say anything to you. Even if I'll take your name, and maybe that is not even your real name. Okay, so that is the beauty of these online classes. So even if you don't know the answer, just put it in the comment section. Just put it in the comment section. Right? Very good, Priyanka. Very good, Dushyant. Very good, Suhasini. No, basically. Suhasini, see, in the ovulatory kit, how can they check that the female is ovulating? Because at that time, obviously, the LH is at peak. No, LH is at peak. Yes, Suhasini, you are right. So basically, luteinizing hormone, its level will be checked. Okay, its level will be checked. The luteinizing hormone. Are you getting my point? The luteinizing hormone, its level will be checked. This is what we have to, this is what we see during that ovulation period. Now, as I said, that this time period is unsafe for the sexual intercourse. So female need to calculate it, and they should avoid the sexual intercourse in that period. So 1 week, or you can say that 7 days before menstrual cycle and 7 days after menstrual cycle are considered as the safe period. During this period, there is no chance of pregnancy. Clear, bache? So this period is considered as the safe period, but again, there can be a risk. So these methods should be avoided. Now, next is the withdrawal method or the coitus interruptus. What is the meaning of coitus? Coitus means sexual intercourse, right, bache? What is the meaning of coitus? Coitus means sexual intercourse, right? Obviously. So, you know that in the insemination, the male is going to ejaculate the semen in the female genital tract. So, what if male, before ejaculation, take out its penis? Obviously, there will be no ejaculation in the vagina, right? And that is the coitus method. That is the withdrawal method. Okay? Okay? So, male is not going to ejaculate in the female genital tract. So, obviously, there will be no semen. Again, even in the last class, I have mentioned this to you, bache, right? That sometimes, you remember Copper's gland, also known as bulbourethral gland. Do you remember Copper's gland? Also known as bulbourethral gland, a pear-shaped gland in the, sorry, not pear-shaped, a pea-shaped a pea-shaped, very small, a pea-shaped gland in the case of males. Okay, so it is for the lubrication of penis, but sometimes it can also pass, you know, some amount of it is basically for the lubrication of penis, but it can also pass some amount of semen. Okay, so that is also not safe. That is also not safe. Clear bache? Clear bache? So next is lactational amenorrhea. So you know that lactation, right? Lactation, milk production in the case of female. So after childbirth, after parturition, female is going to form the, basically in mammary glands there will be the milk production, right, for the baby's feeding, isn't it? So during this period, right, during this period, lactational amenorrhea, that is LAM, that is absence of menstruation, so during this period, because female is heavily lactating, right, for lactation prolactin is important. Remember, prolactin released from anterior lobe of pituitary, it is meant for the production of milk. It is meant for what? It is meant for the production of milk. Prolactin, production of milk. So, and moreover, even oxytocin amount is more. Oxytocin released from posterior lobe of pituitary. It is the milk ejection hormone. What is it, bache? It is the milk ejection hormone. So obviously, when female is lactating, in her body, the prolactin and the oxytocin is too much, right? So at this time, the FSH and LH is absent, right? Their amount is very, very, very less, or absent it is. So if there is no FSH, if there is no LH, obviously there is no chance of the ovulation. Right, it is the FSH which will act on follicles. It is the FSH which is going to help in the growth of follicle, and it is the luteinizing hormone LH which will help in the ovulation. Isn't it, bache? So if both these hormones are not there, so of course there will be no gamete formation. So in the female vagina, in the female genital tract, there will be no gamete. Okay, again it varies from female to female. Some females, they are not heavily lactating, right? So in heavily lactating females, this is the scenario. Okay, so it is considered that after 6 months of pregnancy, after 6 months of childbirth, right, there is no gamete production. It is considered. Clear, bache? Clear, bache? So this is about the natural method, and now we are going to talk about the barrier methods. So just to save your time and to save my time, right, what I have done, I have written some points here. So I am going to explain it to you, right, so that we can save the time, bache. And yes, after the class, in the comment section, you all need to put that which chapter you want me to start next, right? So 1 week for one chapter. So parallelly 11th and 12th syllabus is going on. Clear, bache? Clear, bache? Or anything else that you want me to start? Wherever you need the help, just let me know that, ma'am, this is the topic, we are not able to understand it, or this is a concept, we are not able to understand it. Please put a recorded video. I'm going to do that for you. Okay? Okay, but you have to tell me. And moreover, you guys can be the part of my personal Telegram group as well. That is Love Biology by Ambika. And there is a discussion group as well there. So I'll ask you the poll. In the poll, I'll ask you this thing, right? You can give me the suggestions there. So whatever you need, you have to tell me. You just need to put a comment. Clear, bache? Clear? And before that, please show some energy in the chat section. I can see Harshini is a regular student. Dushyant is a regular student. Kai is a regular student. Priyanka is a regular student. Soumyadeep, on off. है ना? है ना? On off. Sometimes here, sometimes there. Okay? Chalo. So guys, barrier method. So now the word is saying everything, that it is the barrier method. So barrier, which is going to stop something. There is a kind of barrier there. Okay. Ryan is new. Do subscribe our channel then, Ryan. Okay. So in the barrier methods, basically the focus is to avoid the meeting of ovum and sperm. This is what you need to understand, and there is no need to cram. And let me tell you, this chapter is not just for your NEET examination. This chapter is for your day-to-day life also. So you should aware of it. Okay. There should be no hesitation in knowing all these things, and you should know about these things. Okay, that is important for you. Fine. So just listen to me. So now we are talking about the barrier method. So here in the barrier method, the tendency is to avoid the meeting of sperm and ovum. If there is no meeting of sperm and ovum, obviously there will be no fertilization at all. Okay, so this is the concept of barrier methods, and you know that most commonly used method is the condom in the case of males. So males are going to use this condom. It's most commonly used contraceptive method, easily available it is, and playing no role in disturbing the libido, right? Right, bache? That is condoms. So condoms are basically, it's a latex sheath basically, you know, something like this. So it is going to cover the male penis, right? So when it is going to cover the male penis, so during ejaculation, even if the male is ejaculating within the female genital tract, the semen will not be passed there. It will get collected in this latex sheath, isn't it? It will get collected in this latex sheath, right? So this is the condom, right? A kind of, you know, a sheath like barrier method is there, right? So most commonly used brand is that Nirod. It is basically Nirod, like not just the most commonly used, but it was, right? The condoms, they were so so they were sold under the brand name Nirod initially. Clear, bache? Clear? So one thing that you need to remember here is that these condoms, they even prevent STIs, right? The use of condoms during sexual intercourse, it prevents the sexually transmitted infections, also known as venereal diseases, right? It's a very important question. So it basically prevents the HIV AIDS, right? Human immunodeficiency virus used to cause the AIDS now, so it will be prevented by the use of the condoms, right, bache? So this is a PYQ, please mark it. Clear? Please mark it. And sometimes what happens now, some females, they are allergic to latex. Even the male, they are allergic to latex. So in that case, the condoms, they are little expensive and they are made up of polyurethane. Okay, they are made up of what? They are made up of polyurethane. So there is no problem with the latex in that case. Clear, bache? Clear, bache? So it is always advised to use these condoms during the sexual intercourse, not just to avoid the pregnancy, but to avoid the sexually transmitted infections as well. Clear, bache? Right? So now, when it comes to the female condoms, obviously not so popular, at least not in India. So that are femidome, right? So when the word is femidome, what is the meaning of this femidome, bache? Femidome means female condoms, right? So again, it is also a polyurethane pouch. Polyurethane is going to form a pouch like structure. There will be a metal ring there, and that will be inserted there in the female vagina. So obviously when it will be inserted in the vagina, so when there will be the sexual intercourse, the semen will get collected there, right? The semen will get collected there. Again, it will not pass in the uterus and then in the fallopian tube. Clear, bache? Female femidomes. Then comes the diaphragm, cervical caps, and wound. Right? These three methods are for the females only. Okay? They are for the females only. Now, bache, when you talk about these diaphragm, cervical caps, and the wound, let me tell you, they are reusable. This is what you need to write. Okay? These three are reusable. Female can use it again. They are reusable. These three methods are what? They are reusable. So they are reusable, but they play no role. They do not prevent STIs, right? They do not prevent sexually transmitted infections. Why? Because obviously they can be used again and again. So diaphragm is what? It's a tube-like rubber sheet with a flexible metal at margin. So again, in these methods, they are going to cover the vagina, they are going to cover the cervix. So that the sperm should not pass ahead. Clear, bache? So the sperm should not pass. Next. Clear, bache? Is that clear? Yes or no? Yes, everyone. Is that clear? Quick. Quick. Is that clear? Yes, everyone, do hit the like button. And do subscribe our channel if you're new to our channel, bache. And let me tell you, kids, if you didn't join the All India Mock Test series yet, please join it. The link is given in the description box. You just need to click there and you can be the part of that mock test series, right? Some confusion was there related to mock test series. Some students were not receiving the schedule. Now we have made a separate Telegram group for it and you will get the update of it. Clear, bache? Clear, bache? So this is what you people need to take care. Done? then you guys can join that test series. Okay, so now we are talking about the diaphragm, the cervical cap and the warts. So when you talk about the diaphragm, cervical cap and the warts, so let me tell you one thing, bache, they are reusable and do not prevent STI. It is advised to the female that they should not share their diaphragm with others, right? It should be avoided, otherwise there are the chances of the pregnancy. But after, right, this diaphragm, even the cervical cap, you can see here, this is a rubber nipple fitted over the cervix. It is going to cover the cervix, so sperm will not enter into the uterus, right? Volt is also the same thing, some hemispherical dome like rubber which is going to cover these openings. So after the sexual intercourse, female can remove it, can clean it and can reuse it. So obviously it is reusable. The chances to prevent the STI is not there, right? So they are not going to prevent the AIDS. This is what you need to remember. Clear bache? Clear bache? So here you guys can see these images as well. So condoms, right? These are the diaphragms, volt, cervical cap. So see, this is how it is placed, right? This is how it is placed. So it is covering the cervix. Okay, this is the cervical cap. This is how it is covering the cervix. Clear bache? And you know, we used to make it more effective by applying, like let's say this is the cervical cap. So here some spermicidal agent can be applied. Now the question here is, ma'am, what is the meaning of spermicidal agent? The one which is going to kill the sperms, right? Like here over this cervical cap, we can apply the foam, we can apply some creams, we can apply some jellies having the property to kill the sperms. Are you getting my point? So they will become more effective. But again, this is what you need to remember, that they are not going to prevent the sexually transmitted infections. Okay, they are not going to prevent the sexually transmitted infections. Clear bache? Clear bache? So these are the barrier methods. So here you guys can see the shape and the structure. So it is for the females, right? It is for the females. Clear bache? Yes. If there is any doubt, do let me know. If there is any doubt, do let me know. Okay, so next is bache, next is the chemical method. Next is what? Next is the chemical method. Now in the chemical method, the word is saying everything. Some chemicals are used, and what these chemicals can do, obviously it is also the part of temporary method, right? So these chemicals, Dushyant, Shamsheer, Soumyadeep, Harshini, right, Stone, Nitesh, so these chemicals can kill the sperm. They can even decrease their mortality. It depends which chemical are we using, right? So when it is the chemical method, the spermicidal chemicals are used there, the one which are going to kill the sperms. So they are going to attach themselves to that sperm, right? They are going to inhibit the oxygen intake of that sperm and the sperms will be killed. Are you getting it? And the sperms will be killed. So this is how they work. These are the chemical methods, right? They are basically the spermicides. This is what we are discussing. Spermicides, the one that are going to kill the sperms. Are you getting my point? The one that are going to kill the sperm. So here you have the foam tablets, the jellies are there, right? Foam tablets, jellies are there, right? Some other creams are also there. Right, so here you guys can see, here I have mentioned this, you know, a kind of brand name. So foam tablet, Contrap, jellies mein, Perceptin is there. So when you talk about them, right, like see here, sponge, it is given in NCERT. Sponge, today it is a foam tablet. What is it? It is a foam tablet. So it is having the chemical, your non-oxynol 9, which is a spermicide. Are you getting it? Are you getting it? Right, so here we are talking about the foam tablets, we are talking about the jellies. So here you guys can see these are having the spermicidal agents which are going to kill the sperm. So they have chemicals like zinc sulfate, like potassium permanganate, right, boric acid, lactic acid, citric acid, etc. So these are the chemicals which are present there and they will kill the sperms. Clear? Clear bache? So this is what you need to revise, this is what you need to remember. Okay. Okay, so as I said, the sponge today, it is a foam tablet having the chemical non-oxynol 9, which is a spermicide and which is going to disrupt the sperm membrane. It is going to disrupt the sperm membrane. So that is how these chemicals, they work. So these chemicals are applied over these diaphragm, cervical caps and warts, right? And they will make it more effective. Clear bache? They are going to make it more effective. So the next method is very, very, very important, and that is the IUDs. It means intrauterine devices. This method is very important, right? And let me tell you, bache, this method is the most commonly used method in the rural India, right? If in the paper they are asking that which method is used by the females, right? Most commonly used method in the case of female is these intrauterine devices. But as I said, in rural India it is very famous, right? In urban India, females usually go for the oral pills, but in rural India, this is the method which is very, very, very common. Okay, and under the female welfare programs in various government hospitals, in the dispensaries, right? So females, they are getting these things free of cost. So basically, when it comes to the IUD, right, it is intrauterine device. What is it? It is the intrauterine device. So intra means within. What is the meaning of intra? Intra means within a uterus, right? Within a uterus. So ultimately this device will be inserted there in the uterus. You people can see it here. So obviously female should not do it by herself, right? She should not, right? So she needs the help of the doctors, the nurses. Basically professional help is required for the insertion of this IUD. So it is not going to take much time, and these methods are preferred by the females who want to take, who want to give a gap in between the pregnancy, right? Like after first baby, let's say if a female wants to give a gap for 5 years, 6 years, so they can go for these IUDs, intrauterine devices there, right? Intrauterine devices there. Any doubt here, bache? Yes, any doubt here? Clear? Any doubt here? IUDs, intrauterine devices. Okay, so it is the most commonly asked question. It is the most commonly asked question. Clear, bache? What is it? IUDs, intrauterine devices. So here you have three things, right? Three examples are there. One is non-medicated IUDs. So these IUDs, and yes, let me tell you, the first time the IUD, when it was used, it was not copper releasing. Some other chemical, some other ion was there, right? It was not copper releasing IUDs, which were used earlier, right? It was made up of Ag, right? Now what is Ag? What is Ag? Yes, what is Ag? Anyone? Ag? Even I know this. Silver, thank God. Thank God. Thank God. Yes, it is silver. So earlier, right, the first time used IUD was made up of silver basically. So when you are talking about the intrauterine devices, you have non-medicated IUDs, you have copper releasing IUDs and the hormonal IUDs. So now what is non-medicated means there will be no release of the medicine. Like when it is copper releasing, it is going to release the copper. When it is hormonal, of course it is going to release the hormone, right? So when it is non-medicated, it is not going to release any medicine, but I will tell you how will it work. And look at this, right? Can you see this tube-like structure? So this tube-like structure is also made up of, made up of some, you can say that it is basically, some kind of material which will not, ultimately this material is not going to cause the infection here within. Okay, this material is not going to cause the infection here within. So it is a kind of, plastic, a stainless steel, right? Plastic or stainless steel. It is made up of that, and some, these barium sulfate, it is coiled over it. Okay, it is coiled over it. So when you are talking about what? When you are talking about the IUDs, right? Not in all the cases, but this is what generally I'm telling you. So it is made up of some plastic or stainless steel, especially when you are talking about the non-medicated IUD. So here you guys can see the image as well. Okay, so when it is non-medicated, from the word it is clear, bache, that it is not going to release any medicine. So here what you need to remember? You need to remember the example. So when it is non-medicated IUD, we are talking about the lips loop. We are talking about the lips loop. So it is not used worldwide. There are some countries where it is used, right? These days people, they are preferring hormone releasing and copper releasing IUDs more, right? So lips loop is used in some countries, but I will not say that it is very, very, very popular method worldwide. Okay. So as I said, it is made up of plastic or stainless steel, right? So that plastic is impregnated with barium sulfate. So I told you already, when I was telling you about the chemicals, I told you already that these chemicals are basically the spermicide. So why is it impregnated with barium sulfate? Because it is a spermicide. It is a spermicide. Clear bache? Clear bache? So it is going to promote the, now see, this lips loop will be inserted there in the uterus. So it will cause some perforations there, right? What will it do bache? Right? What will it do bache? It will cause some perforations there. Like let's say this is the uterus lining, right? So it is going to cause some perforations, some small perforations there, which are not, you know, so bad, but yes, small perforations will be created. Now what is going to happen? The blood flow towards it will increase, the WBCs will come there, right? The phagocytotic cells will come there. So promote the phagocytotic cells of uterus to phagocytosis of sperms within the uterus. So how this lips loop is going to help? It will cause some perforations in the uterus. So phagocytotic cells will be promoted there. Now, whenever there is the presence of sperm there in that uterus, so obviously that cells are going to destroy that sperms, because they will identify them as non-self cell. They will identify them as the cells which are not the part of our body, and in this way they will be destroyed. Are you getting it? So this is the non-medicated loop. It is the lips loop. Clear? Clear? Right? So next is copper releasing IUD. So as the word is saying, bache, obviously copper ion will be released. Right? Right? See, the copper ion will be released. So we have copper T, copper 7, multi-load 375. Right, copper T, copper 7, multi-load 375. And if you are thinking that, ma'am, why there is a change in the shape? Obviously, in the case of IUDs, they are very safe. Their failure rate is less. But sometimes there are chances that without the knowledge of female, they can come out from the vagina, right? They can come out from vagina. Okay, and very less failure rates are there. So these shapes are as per ki it should not come out, right? It should get fixed there properly. Okay, bache? Okay, so that is why this evolution in the shapes is also there. So when I'm saying the copper releasing IUD, of course it is going to release the copper ions. So these copper ions, you know what? These copper ions, they release some, they increase the secretion of some toxin cytokines. You know, cytokines are present in our immune system. They are the proteins, basically kind of proteins. So when copper ions are released, they are going to increase the amount of these toxin cytokines there. Right, they are going to increase the amount of toxin cytokines there, and these toxin cytokines, then what will they do? They will decrease the sperm motility, they will decrease its fertilizing capacity. So ultimately when we say that copper ions are going to do this, right, so this is how these copper ions are going to work. This is how they are going to help. Are you getting it, bache? This is how they are going to help. This is how they are going to work. Clear? Clear? So copper releasing IUDs mein again examples are important. Many times you people used to get the question on the basis of examples. Keep it in your head, right? On the basis of examples, you guys are going to get the question. So copper T, copper 7, multi-load 375. Copper T, copper 7, multi-load 375. Done, bache? Done. So next is the hormone releasing IUD. Okay, hormone releasing. So the example is progestasert at LNG20. So these examples are very important. Right now you can see these thin threads. Okay, so with the help of these threads, the doctor, the female can check whether this is inserted in the uterus or not. The arms, the stem. So I told you already. So this is the hormone releasing IUD. The examples are progestasert and LNG20. So now these hormones, what will they do? Right? It is the hormone releasing IUD. So now what these hormones are going to do? Of course, but it's very obvious. It's very obvious. These hormones will not let the implantation to occur. They will not allow the sperm to go to the fallopian tube. So they will make uterus unsuitable for implantation and cervix hostile to sperm. So these lines are basically the main lines from the NCERT. Right? You know that it is as per NCERT. It is as per NCERT. So these lines are the most important lines, bache, because question can come from this part, right? And even if you will check the previous year question papers, you will find these questions. Okay, you guys are going to find these questions. So yes, here these are the points which are very important. Clear, bache? So next is the hormonal method. Next is what? Hormonal method. Again, the word is very simple. Hormonal method. They are going to have the hormones. But the question is which hormones? Isn't it? The question is which hormone. So let me tell you here, bache. Here in hormonal method, you will see oral contraceptive pills. What will you see here, bache? You guys are going to see oral contraceptive pills, right? Where you will include, where you will study combined pill and mini pill. In oral contraceptive methods, what you guys are going to see? Combined pill and mini pill. Then comes some injectables. right? Some injections which will be taken by the female, of course. Some implants, they will be subdermal, like below the skin, they will be inserted, okay, and they will prevent the pregnancy. So this is what we need to discuss under the hormonal method, where the most commonly used is the oral contraceptive method, including combined pill and the mini pill, right? Including what? Including combined pill and the mini pill. Are you getting it? So it is most widely used contraceptive method. So how this contraceptive method is going to work? See, it inhibits the ovulation, it inhibits the release of egg, it alters the uterine endometrium, it makes that endometrium lining. You know that it is the endometrium where the implantation will occur, isn't it? It is the endometrium siyam bache where the implantation will occur. So it is going to make that endometrium unsuitable for implantation. That is how these medicines work. That is how these hormonal methods work. I'll explain it in detail. Right, I'm going to explain it in detail. The oral contraceptive having combined pill and mini pill, I will explain it in detail, but as of now, this is what you have to do, right? Just write down this, right? Make the notes, bache, and then I'll explain. So how will it works? Oral contraceptive, they will stop the ovulation, they will do alteration in uterine endometrium, they will make it unsuitable for implantation. The cervical mucus will be changed in such a way that again, it will also become hostile for the sperms, right? It is going to become hostile for the sperms, right, bache? And then there is the inhibition of motility and secretory activity of fallopian tubes, right? So motility is less, obviously gamete will not be passed further, right? So that is how these oral contraceptive pills, that is how they work. Okay, that is how they work. So as I said, there are two things, combined pill and mini pill. So first of all, let's talk about them. Okay, let's talk about them. So what are we discussing? Oral contraceptive method. As I said, it is the most widely used method. It is very popular in urban India, but it is not so popular in the rural India. In rural India, they go for the IUDs. So as I said, one word is the combined pill and another word is the mini pill. Okay, one word is the combined pill, another word is the mini pill. Now, bache, here you will see the hormones. What will you see? You guys are going to see the hormones here. You can see that hormones in combination as well, right? You can see that hormones in combination as well, and you guys can see the single hormone. Only one hormone as well. So which hormone will be used here? Let me tell you this thing first. So obviously, bache, synthetic progesterone and estrogen. When it is the combination, right? When it is the combination, it is going to be synthetic progesterone and estrogen. Synthetic progesterone and synthetic estrogen. So these two hormones are used in combination. Right, these two hormones are used in combination, your progesterone and your estrogen, and as I said, bache, as I said, synthetic progesterone. So you might have read the word progestin, right? I hope you know about it. I hope you know about this word, progestin. Okay, it is progestin. So synthetic progesterone and estrogen. Synthetic progesterone and estrogen, right? And what do we call it? We are calling it as progestin. What do we call it? We are calling it as progestin. Okay, okay, okay. Done, bache? So they are in the combination. So progesterone is more and the estrogen is less. And when only one hormone is preferred, they go for the synthetic progesterone. Right, they go for the synthetic progesterone. Like in the case of combined pills, you have the example of Mala D, you have the example of Mala N. And when it is the mini pill, the most commonly used is, right, Saheli. Right, Saheli. I'll explain it as well. Saheli. So only one hormone is present. Okay, only one hormone is present. And Saheli, you know that it is formed by CDRI Lucknow, that is Central Drug Research Institute, Lucknow. Right, that is Central Drug Research Institute, Lucknow. Are you getting it? So now when we are discussing this combined pill, Mala D and Mala N, Mala D and Mala N. Okay, now how these two hormones are going to work? Because many times students, they are not able to understand that, ma'am, how is it possible that in one contraceptive method, the progesterone and estrogen is there and it is preventing the pregnancy, it is preventing the ovulation? How is it possible? Let me explain you this part, bache. See, you know that, right, when you are talking about the hormones, you know that it is the hypothalamus, which is the supermaster gland. which is a supermaster gland, and then you know about the pituitary, which is known as the master gland. So when you talk about this pituitary, and especially the anterior lobe of pituitary, okay, the anterior lobe of pituitary, also known as adenohypophysis, right, also known as adenohypophysis. Basically adenohypophysis will include the anterior and the middle part both. So anterior pituitary and adenohypophysis. And anterior pituitary is also known as pars, yes, pars distalis. It is also known as pars distalis. Here, anterior lobe of pituitary. So you know that it is going to release what? It will release your gonadotropins. Your hypothalamus will release gonadotropin releasing hormone, GnRH. In response to that, anterior lobe of pituitary will release gonadotropin, which will include FSH and LH. I hope you all remember this, right? It is going to release FSH and LH. It is going to release follicle stimulating hormone and the luteinizing hormone. So FSH will act on the follicles and LH will help in the ovulation. You know that majorly. So follicles in response to that will release the estrogen, and after ovulation, you know that LH is responsible for the release of progesterone, yes or no? LH is responsible for the release of progesterone, yes or no? So you know that in our body a feedback mechanism is present. Yes, Priyanka, in our body there is a feedback mechanism. In our body, this is how the things are going to work. So obviously, when a female is taking the synthetic progesterone and estrogen, when the synthetic progesterone and estrogen is present in her body, so it will send a false signal to the brain. Right, it will send a false signal to the hypothalamus. So hypothalamus will be like कि already progesterone is and estrogen is present. There is no need to release the gonadotropin releasing hormone. There is no need to release the FSH and LH, and obviously they will not act on follicles. They will not act on the ovulation. So ultimately these things will not occur. It is just like कि we are fooling our pituitary that, oh please, there is no need to do anything. Already we have progesterone and estrogen. So that is how it works. Right, that is how, this is the mechanism of action basically. Right, this is the mechanism of action basically. Are you getting it? Are you getting it? So estrogen and progesterone both are present. Sometimes they are present in, you know, nearly equal amount, and sometimes the level of progesterone in comparison to estrogen is more. Okay, in comparison to estrogen is more. So this is how it acts. This is how it works. So as I said, right, oral pills. So now I'll tell you how to take it. What is the story here? So in the case of oral pills, so female need to start it on the 5th day of the menstruation. Basically a kind of last bleeding day, isn't it? Isn't it? On the 5th day of menstruation, she needs to start it, right? How to do this, bache? So female, right, the pills are taken, basically they are taken orally, right, and female need to start it from the 5th day, right? 5th day of menstruation and ends on 25th day of menstruation. So near about 21 days will be there. So female need to take it for 21 days, right? Females, they need to take it for 21 days. So here you guys can see, right? So this is how female is going to get it. Okay, so 1 2 3 4 5 6, see, even the days are mentioned. So female need to start this first tablet on the last day of her menstruation or the 5th day of her menstrual cycle. This is how you can write it, right? Female needs to start it on the 5th day of menstrual cycle, or you can say that last day of her period, right? So she needs to take this tablet, and then next day like this. So for 21 days, here you can see, for 21 days he needs to take it, right? So that is why I have mentioned it 5th day of menstruation and end on 25th day of menstruation. Right, and she needs to end it on 25th day of menstruation. So now there should be a gap of 1 week. There should be a gap of 1 week, right? So earlier, what females used to do, let's say they have started it, right? Now, so here you guys can see these red kind of tablets, but basically these are iron supplements. These are iron supplements basically, right? Earlier, what used to happen, that females, they used to start this, right? For 21 days, they used to get it, and then they used to forgot. They need to keep a gap, they need to give a gap of 7 days, and obviously here the bleeding phase will be there majorly, right? So they need to give a gap of you know, the 1 week, and later on they forgot, right, to start it or something like that. So now in the market it is available like this, that for 21 days female needs to take these hormonal pills, and for next 1 week she needs to take the iron supplements, right? She needs to take the iron supplements. Are you getting it? Are you getting it? And again on 5th day she is going to start it. So this is how it works, right? Now here the hormones are present, these combined pills are there, these hormones are present basically, right? So I told you already, they will inhibit the ovulation, make the endometrium unsuitable, make the cervix unsuitable. So that is how they are going to work, bache, right? So female, she needs to take this, she needs to take this. So this is how it works. Clear, bache? This is how. And yes, female should take it daily, right, and on the same time. Let's say if one day she forgot, okay, so next day she can take 2 tablets because they are hormonal tablets. Next day if again she forgot, right, again she can take 1 tablet, she can again start the cycle. But if let's say for 2 to 3 days she forgot to take the medicine, then again she needs to visit the doctor, and the doctor is again going to start this hormonal cycle. Okay, it's not like that today you forgot, next day okay take 1 tablet. No, next day female needs to take at least 2 tablets, and if she forgets for, if she forget it for 3 days, right, so obviously she needs to go to the doctor, and the doctor is going to guide that. Fine, doctor is going to guide that. So this is how it works, right? This is how female needs to start it. So this is about the combined pills. Clear, bache? Clear, bache? So see, start in the green section, right? So whenever there is the 5th day of her menstrual cycle, she needs to start it. She needs to start it. And for 7 days, as I said, these are the rights. For 7 days, what will be there? Yes, the iron supplements will be there. So accordingly, you guys can relate. Is that clear, bache? Is that clear? Okay, so ultimately the hormonal level needs to be provided. So if she forgot, obviously she can take 2 tablets a day. Okay, okay. So next is what? Next is what? This is about the oral contraceptive method, as I said, Mala D and Mala N. Next is mini pill, Saheli. Next is mini pill, Saheli. So you know that you used to get question in the paper on the basis of it, right? So when it is Saheli, right, as I said, it is formed by CDRI Lucknow, Central Drug Research Institute, Lucknow. It's a mini pill, bache. It is having only 1 hormone, and its preparation. What is the beautiful thing about the Saheli? Its preparation is non-steroidal. It is not made up of steroid, right? Right. You know that sex hormones are steroidal in nature, but here in the case of Saheli, it is non-steroidal. Its preparation is non-steroidal preparation. So it is having that centromen. Centromen is used. There is another name for this chemical as well, centromen. Okay, okay. Centromen will be used. Okay, okay, okay. Done, bache? Fine. Fine. So its preparation is non-steroidal. So it is the contraceptive method with the least side effects. That is why it is preferred, right? It is the contraceptive method with least side effects. Okay, so mini pill, non-steroidal preparation, centromen is there. And let me tell you, bache, when it comes to this, yes, when it comes to this mini pill, right, as I said, it is non-steroidal and having very less side effects. So only 1 hormone is there. Usually you can say progestin is there. Clear? So how to intake it? So for first 3 months, twice, right? For first 3 months, obviously twice a week, and then once in a week, right? Then once in a week. Are you getting it? Right, right. Then once in a week. Are you getting it? Yes or no? Yes or no? So that is how it works. Fine. That is how it works. So it's centromen. Okay. Centromen. Done, bache? Done. Okay. So non-steroidal preparation. So you guys can get a question on the basis of it. So for initial 3 months, twice a week, and then once in a week. This is how it works. And now the next point is, you know, this centromen. The centromen is kind of anti-estrogenic. It is anti-estrogenic. Anti-estrogenic means like it will stop that estrogen receptors. So the implantation will not occur, right? It is going to even affect the implantation. The centromen is what? It is anti-estrogenic. Basically, it is anti-estrogenic. Okay, okay. So it is going to prevent the implantation activity. Okay. But non-steroidal, the preparation, in the preparation they didn't use the steroid. That is what I'm trying to say, Sujita, here. Okay, some sheet is saying block estrogen receptor in the uterus. You are right. So as I said, it is anti-estrogenic. So it is going to prevent that estrogen receptors in the uterus. No estrogen receptor means no endometrial lining endometrial lining will not grow. So obviously it will be unsuitable for the implantation. So that is how it works. Is that clear? That is how it works. So this is about the oral contraceptive method. So the question on the basis of this, you guys can get question on the basis of it. Clear? So next is emergency contraceptive pills, which is morning after pills. So let's say if there is the unprotected sexual intercourse, any reason can be there. It can be the sex abuse as well, right? So in that case, female can take this pill, right, within 72 hours of unprotected sexual intercourse, right? Within 72 hours of unprotected sexual intercourse. So I pill and all, these are the morning after pills. These are the emergency contraceptive pills. They will not allow the gametes to fuse, and if they are fused, the implantation will not occur, right? The implantation will not occur. So these are the emergency or the, right, emergency or the morning after pill. So this is Saheli, non-steroidal, and once a week tablet it is. So twice a week for first 3 months. This is what you people miss. It is even given in NCERT. So no doubt it's a once a week tablet, but as I said, initially for 3 months, female needs to take it for twice a week. Clear, bache? And then once a week. Done? Then once a week. And now, bache, we have this, injections. Of course, they are also hormonal. They will prevent that ovulation and all. This is how it is going to work. And these are the subdermal implants, right? So these are, some silicone-like structures, like a fan. They will be inserted here subdermally. So they release the hormones. So they can even use for 5 years, because they will keep on releasing the hormones. And I told you how these hormones work. And even in the case of IUD students, let me tell you, right, that IUDs are functional. They are effective for 5 to 7 years. It depends which IUD female is using, right? So even for 7 to 10 years, right? And then they need to reinsert it. Same is for the implants. So female needs used to take these implants. Okay. So hormones are released. So it is going to prevent that ovulation and all. Clear, bache? Clear? So this is how it works. I'll tell you about it. Fine. So see, this is the injection. So it is Depo-Provera contraceptive injection. Depo-Provera contraceptive injection. So here you guys can see Depo-Provera. So it is having, 2 chemicals. One is depot medroxy progesterone acetate, DMP, right? It can have these. Depot medroxy progesterone acetate. It is effective for 3 months. And another is norethistérone enanthate, that is Netten. So sometimes they both are used in these injections, and sometimes, sometimes this preferred. So it is effective for 3 months. This one is effective for 2 months. Okay, this one is effective for 2 months. Clear, bache? And then when it comes to the implants, I'll give you the example of Norplant, which can be, used for 5 years. So it is having progesterone only, right? So that silicone, say, pipe-like structures are there. Subdermally, they will be inserted. So ultimately, they will release what? They will release hormones. Clear, bache? So this is about these, methods. Okay, you guys can see it here. And then you know that when it comes to the permanent method, the vasectomy and the tubectomy. And even immediately after the vasectomy, it doesn't mean that immediately after the vasectomy, male will become infertile. No, generally it is advised that even after vasectomy for 2 to 3 months, male should use the condom, right? And even the use of condom is always advisable. Why? Because it prevents the sexually transmitted infections. Okay, it prevents what? It prevents the sexually transmitted infections. So always the use of these condom is always advised. So now doctors, even after the vasectomy, they advise the male to use the condoms, because some sperms, they are already stored, they are already present in the semen, right? Later on, so obviously they will not pass, but maybe few are already stored there, or sometimes they can pass in that semen. So just to avoid any chance, so initially for 3 months, male should use the condom. Okay, right, bache? So this is the sterilization. So this is all about the contraceptive method. So if there is any doubt, do let me know, bache. If there is any doubt, do let me know. And one student was asking about the side effects. Obviously, bache, see, if female is going to take that emergency pills quite frequently, it is going to affect it, right? See, we are externally taking the hormones, which is not good for the health, right? Which is not good for the health. That is why. No, implant, Pravina, the Norplant is for the 5 years. Okay, so sometimes, the IUDs can cause the irritation in the uterus, right? Sometimes it can cause the inflammation. Periods can get disturbed. Periods can become irregular. So these are some common side effects. Okay. And in the case of males, usually they don't have pill, only one pill is there, Gosipiel. One pill is there. It was used in China, so it prevents the sperm production in the case of males. Gosipil. Okay, Gosipil. Clear? Clear? So next is bache MTP. That is medical termination of pregnancy. It is also known as induced abortion. Induced abortion. Okay, right? MTP, medical termination of pregnancy and induced abortion. And in India, it was legalized in 1971. Right, in 1971. Let me tell you, bache, what is there in the case of MTP or in the induced abortion. Abortion means to kill that baby, to kill that fetus, basically. Okay, to kill that embryo, basically. This is the meaning of that abortion. Induced abortion. Female is willingly killing that baby. Okay, why is it so? There can be any reason. Maybe that pregnancy is not healthy for the female or for the baby. Maybe that embryo is having some genetic defect. Right, it can be the reason. Maybe that pregnancy is because of the sexual abuse and female is not ready for it. Right, and maybe it is unwanted pregnancy. So any reason can be there. Although always keep it in your head that MTP is not used to control the population, not at all. If there is the unwanted pregnancy, right, if there is the unwanted pregnancy, if there is the pregnancy is the result of sexual abuse, if that pregnancy is dangerous for the mother and for the fetus, right, if it is unwanted, so in that case MTP is advisable. MTP is legalized in India in 1971. And let me tell you, students, there are many countries where still the MTP is not legalized. It is not legal. Whatever is the scenario, right? Whatever is the scenario, even if that pregnancy is dangerous for female, no. Even if it is, even if it is the result of the sexual abuse, no. If it is the result of the rape, no. In some countries, they do not, right, legalize this MTP, and even there is a punishment is there for that MTP and all, right? So this is your homework. You will check it, you will mention it in the comment section that which countries are there where the induced abortion, the MTP, is not legalized. This is your homework. So will you do it? Yes, everyone, will you do it? Medical termination of pregnancy. Yes, MTP it is. Medical termination of pregnancy, MTP it is. So here you guys can see, so it is the intentional or voluntary termination of pregnancy before full term, obviously, right, bache? So nearly 45 to 50 million MTPs are performed in a year all over the world. Okay, all over the world. Clear, bache? Clear, bache? So it accounts to 1/5 of the total number of conceived pregnancy. So like in a year total, out of total number of conceived pregnancy, 1/5, right, 1/5 pregnancy will be aborted. Clear, bache? It will be aborted. So obviously, as I said, it has a significant role in decreasing the population, but it is not meant for that purpose. Like MTP cannot be used for decreasing the population, right? Right, and see, in MTP is legalized, but that doesn't mean, right, that doesn't mean that everyone can go and ask for the MTP. No, it is not, right? So certain set of criteria is there. If that is the reason, then obviously, like let's say if that female is too young, yeah, whatever it is, right, in that case it is allowed. But some people, because they use it for the female feticide, if they know the sex of the fetus and they don't want a girl child, so then people also, they go for the MTPs, which is not right, right? And they need to, right, they will get the punishment if it will be reported. Fine, bache? Fine, bache? So to accept or legalize MTP is being debated upon in many countries due to emotional, ethical and religious and social issues. Like in some religion, they do not, right, they consider it unethical to kill the fetus, right? They think that whenever there is the heartbeat, it means that life is there, right? And you know that in the first trimester of pregnancy, in the basically the 5th week, the heartbeat starts, the heart start pumping the blood, right? So in many religions, it is considered when that heart starts beating, when that heart start pumping the blood, the life is there. Some still consider it as a, a mass of cell or something, but in some religion it is like that. And in that countries, that MTP is not legalized at all. Clear, bache? So government of India legalized it in 1971. It is very important MCQ. Okay, but yes, some strict conditions are there to avoid the misuse. Clear? Clear, bache? Right? Clear? So MTP mein what we need to take care. So when it is advised, you know that human gestation period is for 9 months. like near about 38 weeks. Human gestation period is of 9 months, 38 weeks, you know that. So first trimester, right? The first trimester is of 12 weeks and the second 24 weeks. So for 12 weeks, it is considered safe, right? MTP is considered safe for initial 12 weeks. It is considered safe for initial 12 weeks because the development is not that much yet, right? Here the skeleton is not bony yet. Okay, so it is easy to terminate that pregnancy. So first 12 weeks, yeah, first trimester, right? It is considered as a safe time for that MTP. Okay, bache. And sometimes in some scenarios, let's say there is some genetic defect or something which is detected later. So yes, even 20 weeks are also preferred, 24 weeks are also preferred. But yes, initially for the first trimester, if female wants to take the MTP, right, and the pregnancy is there in the first trimester, so the signature of one medical practitioner is required. But if it is for the 24 weeks, because it is bit, now the growth is more, so it can be dangerous. So in that case, 2 doctors need to sign that form. Okay, 2 doctors need to sign that form, right? This is what you need to take care. Okay, so MTPs, as I said, they are considered relatively safe during first trimester up to 12 weeks of pregnancy. Second are much riskier, second trimesters are much riskier, right, bache? So that is why 2 medical practitioners, they need to sign it. And another dangerous trend in this is the misuse of amniocentesis to determine the sex of the unborn child. So sometimes they determine the sex of the unborn child. I told you about it, na? That in 16 to 20 weeks, 16 to 22 weeks or 15 to 22 weeks, amniocentesis is performed in this period. So sometimes, they detect the sex of the fetus and they go for the abortion, which is illegal. Okay, which is illegal. So this is about the MTP. Clear, bache? This is about the MTP. Now I have added something for all of you so that you guys can, yes, you should know about it basically. Right, so here you guys can see the parameter: contraceptive failure, limit of gestation, opinion of doctor, fetal abnormality. So as per MTP Act 1971, married women can take it, or termination can be done up to 20 weeks, right? So for first trimester, the signature of one medical practitioner is required. For 20 weeks, 2. So some amendments were made, right? So fetal abnormalities ke case mein 20 weeks limit on gestation. And in 2021, some amendments, some changes were made. So both married and unmarried women can avail it, right? So up to 24 weeks, they can go for MTP. So as I said, for 20 weeks, one medical practitioner need to give the opinion and need to sign the papers. And for 24 weeks like this. So this is for you, right? Right, bache? So that is what, this is what I have added for you so that you will get an idea, okay, about it. So these are the, general issues. One should know about it. It should not be related to your NEET examination only. You should know about it. Clear, bache? You should know about it. Done? Done. So next is the STIs, which are also the STDs, sexually transmitted disease, or we are also calling them as sexually transmitted infections. Sexually transmitted infections. It's venereal diseases. Right, these are the venereal diseases. These are the reproductive tract infection. So you should know this name as well, right? Venereal diseases. So, bache, there are different causative agents that can cause it. Obviously, the one obvious reason is the unprotected sexual intercourse, right? It is the one obvious reason for the STI. So, and the sexual intercourse with multiple partners. So when there is a sexual intercourse with multiple partners and it is unprotected, definitely it will result in STIs. It will result in infections, and they are very dangerous. It's not that these infections are only going to affect the genitals. No, sometimes cause infection in the eyes as well. Like if I talk about the AIDS, acquired immunodeficiency syndrome, if the mother is having the AIDS to placenta, if the mother is having the AIDS, the baby can also have some symptoms, right? So it is like that. It is like that. So here I have listed some, the STIs: chlamydia, gonorrhea, trichomoniasis, genital herpes, syphilis, chancroids, genital warts. And here we have added the causative agent. So in detail, we will discuss it in human health and disease, but still I will give you an overview. You know that in NCERT it is not explained in detail, but still I will tell you about the symptoms. I will tell you about everything here. Clear, bache? Clear, bache? So if there is any doubt up to this part, do let me know. If there is any doubt up to this part, do let me know. Yes, quickly. Quickly. yes. It's clear. HIV is human immunodeficiency virus, Bhaskar, and it used to cause the AIDS. HIV is a virus. Okay, so guys, here in these diseases, right, they can ask you in the paper, they can ask you the question about the causative agents. They can ask you that which one is the bacterial STI, which one is the viral STI. So question like this can come. Just say syphilis, gonorrhea, chlamydia. These are bacterial STIs. Syphilis is caused by Treponema pallidum. Syphilis is caused by Treponema pallidum. This gonorrhea, Neisseria gonorrhoeae, again a bacteria. So here na bache, bacteria is having the fimbriae. So that fimbriae will help that bacteria to get attached to the host substratum, to get to attach to the host, right? This trichomoniasis, Trichomonas vaginalis, protozoal disease it is. Let me write it here. It's protozoal disease, right bache? This cancroid, again bacterial, Haemophilus diphtheriae, genital wart, right, and genital herpes. These are the viral disease. Herpes simplex virus, human papilloma virus. So this is what you need to remember. This is what you need to revise. Okay, okay. The question can come from the causative agent. The question can come, yes, bache, the question can come from the causative agent. They can ask you this question. Right? They can ask you about the causative agents, whether it is bacterial or viral, and even the name can be asked there. So as I said, syphilis very important, Treponema pallidum, Neisseria gonorrhea used to cause gonorrhea, right? Trichomoniasis, Trichomonas vaginalis. In the case of males and females, they are going to affect. So the most common symptoms are obviously swelling in the genitals, inflammation in the genitals, the discharge will be there in the genitals, the, some odor will be there in the genitals, right? Irritation can be there in the genitals. These are the most commonly occurring symptoms. And even this chlamydia is very dangerous, and especially in the age group of 16 to 25 years old. Okay, 16 to 25 years old. Clear, bache? Clear. So here you guys can see the detection techniques as well, not so important. So here I have added some symptoms, like when it is chlamydia, there will be the unusual discharge from the penis, right? The swelling and pain will be there in the testicle, burning sensations will be there while urinating, rectal pain, and the discharge or bleeding will be there. Okay, okay. And gonorrhea mein burning sensation, common it is, yellow, white or green discharge, painful testicles. In the case of syphilis, multiple sores will be there around the penis, skin rashes, fever and headache can occur, swollen lymph nodes can occur, sore throat, weight loss, fatigue, right? So if they are not detected, if they are not treated, because people is having the stigma, they don't visit the doctors to ask for to discuss regarding this, but it is dangerous, right? If it is detected and cured, then fine, otherwise it will be a problematic thing. Clear, bache? Clear, bache? So long term mein urethritis, inflammation of urethra, proctitis, inflammation of rectum, these things can occur. Clear, bache? These things can occur. Done, done. So chlamydia mein, women mein, as I said, abnormal discharge, burning sensation, all that things can occur. Okay, and gonorrhea mein, even during the childbirth, when the blood of the mother and the baby will come in contact, then it can also pass the disease to it. Okay, it can also pass the disease to it. Yes, death can also occur. Clear, bache? Clear, bache? Yes, is that clear? Is that clear? Fine, fine. So next is infertility. See, even AIDS is also there, right? Genital warts, human genital warts, your herpes simplex virus, genital warts, your human papilloma virus, right? AIDS is caused by human immunodeficiency virus. So you should know the viral hepatitis B virus. So you should know the viral diseases as well, the bacterial diseases as well, the protozoal diseases as well. So hepatitis B virus we also discuss here, right? It is right, mainly obviously it is going to affect the liver, but we also discuss it here. So this is your homework. In the NCERT you have to read it, right? From the NCERT you have to read it. Like in the NCERT, even it is given that few diseases are curable, right, but some are not at all curable. So you need to tell it to me in the comment section. It's a very commonly asked question, that which disease out of these STIs are which disease out of these STIs they are curable and which disease are not curable, right, bache? So which one is permanently curable or not curable? This is what you are going to put in the comment section. And let me tell you, it's a very important point, bache. It's a very important point. It's just that I'm not sharing it with you because I really want to see whether you will study or not. Okay, and I am going to see the comments and I will pin your comments and I will thank you in the next class. Okay, okay, so this is what I'm expecting, and I think my expectations are minimum, isn't it? Isn't it? Okay, okay. So next is what? Next is infertility. Next is what? Infertility. So in detail about the symptoms and about everything, I will discuss it in the human health and disease chapter. Okay, I'm going to discuss it in the human health and disease chapter. Clear, bache? Okay, 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 okay. Okay, and yes, I'll add one question here. It's a PYQ, so I'm sharing it here only. Right, in the case of gonorrhea, na, if the bacteria will pass to the newborn, so it can cause blindness in the newborn. It can cause eye infection in the newborn. So this is a question that I have practiced few days back. So I thought that I should share it with you. Right, in the case of gonorrhea, you will see the eye infection in the case of babies if the bacteria will be passed. Okay, okay. Syphilis mein some cankers are there. Right. Syphilis में भी some cankers are there, and cankeroid तो definitely cankers are there. ठीक है? So practice the questions on the basis of this. So next is बच्चे infertility. Again a very simple method. We are about to finish the lecture in next 15 minutes. So it is a very commonly asked question. Okay, it's a very commonly asked question and it is the easiest question. So there is no chance that you will make mistake here. Okay, so infertility. Infertile, when the couple is infertile, when we say a couple is what? Infertile, means after having unprotected sexual intercourse for 1 to 2 years, still they are not getting the babies, still pregnancy is not taking place. Right, when do we say one couple is infertile? When even after the 1 to 2 years of unprotected sexual intercourse, they are not having the babies. Right, they are not having the babies. That is the infertility. So in India, initially only females were blamed for it, right? That there is some issue in the female. But later on, later on, with more studies, right, it was also found, basically not with the studies only, but basically people were not aware. According to them, there is issue in the female only, right? But later on, even the males, they have accepted it. So now you know that I will not say the things are balanced, but still better than earlier. Okay, still things are better than earlier. And if I talk about the infertility, right, so because females were blamed, so that when it comes to the test tube baby program, right, so it was when it was initiated, this was the idea behind that always only females are blamed, right? So it is a serious issue, one should take care of it. So there should be some steps to treat the infertility. Now in India, you know that, right? So like people talk about it, they discuss it. Right, now there are various facilities that are provided to that couple so that they can have the babies. You know about the test tube baby program also, and today this is what we are going to discuss. Now there are two types of infertility. One is primary, another is secondary. When we are saying primary infertility, right, when we are saying primary infertility means that couple, they never had babies, right, that there is no pregnancy at all, there is no pregnancy at all, primary infertility, right? And when it is a secondary fertility, let's say that after first pregnancy female is not able to conceive, yeah, multiple abortions are there, the baby growth is not there, so that things will come under the secondary infertility, right? So we have two things here. What do we have here, bache? One is the primary infertility, another is the secondary infertility, right, bache? What do we have here? One is the primary infertility and another is what? Another is the secondary infertility. Clear, bache? Another is the secondary infertility. Clear, bache? Clear, bache? So it can be detected in the males and in the case of females as well. Males ke case mein, you know that what is the issue? The sperm count, right? The sperm count. If the sperm count is less, remember oligospermia. If the sperms, they are less than 20 million in per ml, so it is oligospermia, right? And even if sperms are unhealthy, right, they are not motile or something, right? Even if sperms are absent in the semen, that can also be the case. So in the males also, these are the most commonly occurring issues: the sperm count, the unhealthy sperms, the hormonal imbalance can be there, the sperm, maybe the spermatogenesis is not there, like you know na, gynecomastia, the example of hormonal imbalance. here in the case of males, the estrogen level is high. The estrogen level is high, so the mammary glands are developed, right? Mammary glands are developed. So in that case also, if that male can also face the fertility related issues. Okay, that male can also face the fertility related issues, isn't it? Isn't it? Right? Gynecomastia and cryptorchidism. I hope you remember this cryptorchidism. If testes are not descended into the scrotum, right? If testes are not descended into the scrotum, even in the case of males, it can result in the infertility, isn't it? Right? Now see, when testes are not descended in the scrotum, means testes are present in abdomen. But in the abdomen, the cell that used to, basically in the male reproductive system, in the testes, the cell that used to release your testosterone is Leydig cell, also known as interstitial cell. That cell is your Leydig cell, also known as interstitial cell, right? This Leydig cell is not temperature sensitive. Even if the testes, they are not descended in the scrotum, so it means the Leydig cell is still functional. Leydig cell is not temperature sensitive. This interstitial cell is not temperature sensitive. It will keep on releasing testosterone. So like male secondary sexual characters are for sure there. Male secondary sexual characters are for sure there. But because these testes are not descended in the scrotum, so the spermatogonia, which is temperature sensitive, the spermatogenesis will not occur, the gamete formation is not there. So obviously the male will be infertile, yes or no? The male will be infertile, yes or no? So Ashini, Shamsheer, Sujita, Store, male will be infertile, yes or no? Yes or no? Of course, 110%. Right, 110%. And other than that, as I said, Klinefelter's syndrome, that will cover under that will cover here, right? Klinefelter syndrome can be there in the case of males. Let's say the vas difference is blocked, right bache? Let's say the scrotum is having too much of temperature, yeah, male is working somewhere where the temperature conditions are high, so obviously in that case also the gamete production can affect. So all that things can result in the infertility, right? All that things can result in the infertility. And if I talk about the females, in the case of females, anovulation can occur. Right, in the case of females, anovulation, like see, egg is not there in the menstrual blood. Yeah, egg is not present. The egg production is not there. So even this can also be the case. This can also be the case. So obviously again here, hormonal imbalance can be the issue. Maybe from fallopian tube, the ovum is not getting passed. Right, right. So anything can be there in the female. And in the case of female, it can be related to the gamete production. It can be related to the uterus health as well. Maybe gamete production is proper, but the uterus is not healthy, implantation is not there, so anything can occur. Anything can occur in the case of female as well, right bache? So to treat this infertility has it is a very important thing bache, because you know that mostly females are blamed. So we'll talk about the test tube baby program. Actually bache, when we study the history na, right, if you will check, I have studied it. So test tube baby program, I have studied it. I'll tell you one thing, like when I was studying about it now, so we talk about two scientists, like one scientist who initiated, right? It was even considered as the first scientist to initiate this in vitro fertilization, to initiate this test tube baby program. But that scientist didn't get the recognition. There were some mentally that scientist was abnormal and some suicide thing was there. Right, so he didn't get the credit for it, and later on the doctor which is famous for it, like she revealed it, right? So the history is very interesting there, right? So we should not digress, so that is why I'm not discussing that with you, okay? But that is the case, okay? That is the case with this test tube baby program. That is the case with this what we used to call it, yes, that is the case with this IVF and all, right? If you will study this history, you will find it interesting. Just India mein we consider the first test tube baby is to be Durga, right? That Durga is there, but no, before that I am telling you that scientists didn't get the recognition, but he was the one to initiate it, okay? He was the one to initiate it. Clear? Test tube baby program. Okay, so in India is the second country to start it basically, right? So Durga was that first test tube baby. So initially when I was of your age, honestly speaking, I used to think like this, that baby will grow in a test tube. But actually this is not the case. Literally this is not the case. When I was in class 12, this is what I used to think. Test tube baby means the baby will grow in a test tube. No, it is not possible, right? It is not possible. Actually, it is the example of vitro fertilization. It is the example of in vitro fertilization. So now, bache, when we use the word in vitro means lab conditions. What is the meaning of in vitro? In vitro means lab conditions, right? Lab conditions, like something is taking place in a lab, in a controlled condition. So outside the body, when there is the fusion of gametes, right, and there is the formation of zygote, of course, that is the in vitro fertilization. That is basically IVF. So here, right, just to treat that infertility, there are many techniques that we discuss under art, that is assisted reproductive technologies. Assisted reproductive technology, right, bache? Right, assisted reproductive technology. So here we are even talking about the in vitro fertilization, where the gametes are fertilized outside the body, the embryos, the zygote, the embryo will be formed, that will be again implanted in the female. Okay, in vitro fertilization. So in vitro fertilization, IVF, as I said, here what do we need to consider? Where the fertilization is outside the body, and it can be in vivo. In assisted reproductive technique, some in vivo fertilization ways are also there. In vivo means within the body, right? Here, right, the gamete fusion is there within the body. So this is how we need to study, right? This is how we need to study it, right, bache? So we are going to talk about the different techniques here. Can you name it? Yes, can you name it? Anyone here in the class? This is the last topic, you know that. Can you just name it? Which techniques do we study here, right, in this assisted reproductive technologies? Which techniques do we study here? Like I told you, no, there are two ways. One is in vitro fertilization, IVF, and another is your in vivo fertilization. Anyone, do you know about the in vitro fertilization technique? There is a question on the basis of it. Yes. So here you have ZIFT, intra, Hanji. So there are techniques here. One is your ZIFT, right? One is your ZIFT, your intrauterine transfer is there, right? IUT, the intrauterine transfer is there, and ICSI, intracytoplasmic sperm injection. And when it is in vivo, GIFT, artificial insemination, or intrauterine insemination is there. So these are the techniques that we need to study here, right? These are the techniques that we need to study here. So see, in vitro, when the fertilization is outside the body. In vivo, when the fertilization is within the body. So it is a most commonly asked question, right? It is a most commonly asked question. So now, bache, when you are saying ZIFT, it means zygote intra-fallopian transfer. Zygote intra-fallopian transfer. I will explain it in detail, but as of now, just mark it. IUT. Again, intra means within. Uterine transfer. Intra-uterine transfer. The name is explaining everything. ICSI. Intracytoplasmic sperm injection. Intracytoplasmic sperm injection. Okay, and GIFT here is gamete intra-fallopian transfer. Okay, and this AI means artificial insemination. And in that artificial insemination, if that insemination is within uterus, directly within uterus, not in vagina, so intrauterine insemination. So let me explain this. So this technique, these techniques are very easy, right? It's a very easy part. ZIFT, zygote intra-fallopian transfer. Zygote will be transferred within the fallopian tube. So it simply means the fertilization is outside the body. Right. So fertilization is outside the body. The eggs, the zygote will form outside the body, and then what is going to happen? Bache, the embryo will form, like 8 to 16 celled embryo. Right? You know that no? There are the different stages. I hope you know about it. I hope you people are aware of it. Right? So when, see, if that embryo is up to 8 blastomere stage, outside the body it is growing. Obviously, sterile conditions are there, proper labs are there, proper temperature will be maintained, everything. Basically the doctors are going to take care of everything, right? And you know, there are some advanced diplomas in this line for the IVF and all. Even if you are not from this background, you can even pursue some diploma courses there, right? And you can be the part of any research lab there. So what is going to happen here? What is going to happen here? Zygote will be transferred within the fallopian tube. So that zygote should be up to, I thought I'd do, okay, done. So that zygote will be up to 8 blastomere stage. Up to 8 blastomere stage. So it will be passed there in the fallopian tube. Then further stages will occur and then implantation. If it is more than 8 blastomere, again the embryo will be passed. So obviously the fertilization is outside the body, so it is IVF. When it is ICSI, intracytoplasmic sperm injection, so bache, its success rate is maximum, right? This is the technique where success rate is maximum, right? So directly intracytoplasmic sperm injection, that sperm nucleus will directly be inserted there in that egg. So obviously chances of fertilization are more. So outside the body it is. So again, it is also the in vitro fertilization. Now gamete intrafallopian transfer, like in some people gamete formation is not there. Let's say in female the gamete formation is not proper, your male gamete formation is not proper, but uterus is good for the implantation. Uterus can bear the pregnancy. So in that case only gamete will be transferred. So gametes are transferred within the fallopian tube. Gamete intrafallopian transfer. So gametes are transferred within the fallopian tube. So means fertilization will be there within the body. So that is why in vivo fertilization, artificial insemination. Let's say in the case of males, the sperms are not healthy, the sperm count is less. So in that case, the sperm from, you know, some relative can be collected, from any donor can be collected, or sometimes male is having erectile dysfunctioning, sperm production is there but insemination cannot occur. So in that case also sperms will be extracted and will be inserted artificially in the female genital tract. So if it is inserted in the uterus directly, so intrauterine insemination, right, it can be inserted in vagina as well. So this is what you need to know, right? Which is in vitro, which one is in vivo. This is something very important. Clear, bache? This is something very important. Is that clear? Yes, everyone. Is that clear? So here you people can see, right? So zygote, the ZIFT, zygote intrafallopian transfer. So you can see the zygote will be transferred here. So it is up to 8 blastomere stage. It is up to 8 blastomere stage. Clear, bache? Right? So this is, see, sperm and eggs are injected. So it is GIFT, which is in vitro fertilization. It is in vivo fertilization. GIFT, gametes will be inserted there. Okay, look at this, right? So see how they are passed here. Okay. So obviously the doctors, they are experts, those who are going to take care of it. Okay, and here it is the surrogacy. We will talk about the surrogacy, but first of all, let's read it from the NCERT. Clear, bache? So what are we discussing? We are talking about the infertility. So see, infertility, a very common problem because of lifestyle that all are facing. So see, a large number of couples all over the world, including India, are infertile. They are unable to produce children in spite of having unprotected sexual cohabitation, right? In spite of having unprotected sexual intercourse, they are not able to produce the babies, right, bache? So reason can be anything. It can be physical, congenital means by birth, right? Some disease can be there, drug abuse can be there, some immunological issues, psychological issues can be there, right? Anything can occur in this infertility. So as I said, often female is blamed, right? When they are childless, when a couple is childless, often females are blamed, right, bache? So specialized healthcare units, infertility clinics are there, which will help in the diagnosis and the treatment of their disorders, right? And the treatment of their disorders. So all the techniques which are going to help there is assisted reproductive technologies. Clear, bache? Assisted reproductive technologies. So in vitro fertilization, as I said, that is IVF, right? So outside the body, similar conditions will be provided and the fertilization will be there. And after it, what will happen, bache? Embryo transfer. Okay, embryo transfer. So it is a test tube baby program, right? What we used to call it, test tube baby program, right? So the gametes can be taken from the wife or from the donor, right? Sperm can be taken from the husband or from the donor. It depends. Clear, bache? So when zygote or early embryos, this is important, up to 8 blastomere, this is important, right? So when it is transferred within the fallopian tube, ZIFT. So that's what you need to focus. And if it is more than 8, intrauterine. So this is in vitro fertilization. So as I said, intracytoplasmic sperm injection is also the part of in vitro fertilization. Next is bache in vivo, fusion of gamete within the body, right bache, right, where female, you know, the gamete production is not so healthy there. So transfer of ovum collected from the donor into the fallopian tube. So it is GIFT. So it is very, very, very easy, right? So it is, this method is used for those female where the uterus is suitable for the implantation, but it's just that gamete production is not there. Clear? Clear? Then is ICSI. So it is a method to form an embryo in the lab. So if it is formed in the lab, obviously it is the example of in vitro fertilization, right, bache? So sperm is directly injected into the ovum. Clear? Clear? And then I told you about the artificial insemination as well. And then comes the surrogacy, right? Then comes the surrogacy. I hope you know about the surrogacy or surrogate mother. Let's say there is one couple, female uterus is not perfect for the pregnancy, or sometimes, you know, these days to paid surrogacy is also there. Like some females, they don't want to give birth to their own child, means they don't want to use their uterus, they want another female to give birth to their children. Like sometimes couples, they want it, right? You all have seen the case of Priyanka Chopra. With the help of surrogacy, she got her daughter, right? Right. I hope you know about it, right? Priyanka Chopra, the actress, in her case, she preferred the surrogacy for the childbirth. So sometimes people, they are preferring because they don't want, the females, they don't want to give birth to their child, and sometimes, you know, because female uterus is not compatible, yeah, she is not able to. So any case can be there. So when it is a surrogacy, like a couple, they can ask the relative, they can ask some other women. Obviously the medical history will be checked, everything will be checked. So she is going to take her baby in the womb, right? So with the help of IVF, with the help of IVF, even the zygote can also get implanted, or they can even prefer that gamete transfer technology, right? So that female is going to give birth to their child. So this is what surrogacy is, right? And this is all about this chapter. So as I said, the disease, right, the sexually transmitted infections, I will discuss it with you all, but in the human health and disease in detail with all the symptoms. But as of now, this is all about the chapter. So we are done with the human reproduction, we are done with the reproductive health. Now in the comment section after the class, you have to write it, bache, which chapter you want me to start next. And moreover, I'll provide you the PDF in the Telegram group, right? So you guys can even join my personal Telegram group or our official Telegram group as well. You can join both, right, bache? You can join both. So I'll provide you the PDF and the schedule for upcoming classes there. So as per your preference, we'll start the next chapter. This is what you need to tell. And only one request, it will hardly take your 10 seconds. So please put a comment in the comment section that you liked this video or not. Okay, how was the session? How was the teaching? Okay. So if there is any other suggestion that, ma'am, please start the topic on this, please start this chapter and that chapter, you guys can put there in the comment section. Clear? So thank you so much for watching. Stay tuned, take care. We'll soon post another short videos for you as well. So thank you, stay tuned. If you're new to our channel, do subscribe our channel, and PDF will be provided in the